Hi, good evening, and welcome back to Seeing Eye to Eye at blackdoctor.org. And tonight we are blessed to have Dr. Kristen, correct? I should have checked that before.
Yes.
Kristen Snyder and Dr. Tiffany Humes. And we are going to talk about dry eye because July is it's eye health a month, or eye healthy eyes a month or something. And so
Yes.
what you need to know to keep your eyes healthy, and specifically, like I said, we're going to cover dry eyes. So I'm sure everyone knows somebody. So please, housekeeping, of course, please everyone share the broadcast. Sharing is caring. And if you have questions, you can put them in the chat and I will do my best to answer them. Also, in the chat, if you could let us know where you're watching from, we would greatly appreciate it. So we will get started. So, Dr. Schneider, let's start right at the top. What is dry eye?
Okay. Yeah. So dry eye is when your eyes don't make enough tears, or make enough tears and they evaporate right away because your oil glands, which are these glands that are located right along the lower and upper lids, they make oil. If those are malfunctioning, then your tears evaporate right away. So it's usually multifactorial.
Okay. And how many people have dry eye? Is it a condition growing in prevalence or?
Yeah. So
Okay.
16 million Americans have dry eye, just about, and it's growing in prevalence. It affects women more often than men, and it's growing in prevalence
Mhm.
now in younger people under age 18, just because of our
You broke up because of what?
screens.
Oh, wow. Really?
And studies actually showed that during COVID, that number increased because more people were spending so much more time on screens.
Wow. Well,
Isn't that
this accounts
fascinating?
for all of, yes, this accounts for all the commercials, though, about all the fake tears, because there are a ton. And I
There
never
are.
knew, did these things work or not. I wear contacts sometimes, and so I don't do the fake tears, but I'll do the re-wetting drops, but very rarely. So, but that's interesting that the screens, wow. So
Absolutely.
Dr. Humes, what are symptoms of dry eye?
Thank you for asking, Dr. Renee. Believe it or not, there are a bunch of different symptoms. Your eyes might itch, they might water or tear. You might feel like there's something in your eyes sometimes, like a sandy or gritty sensation. You might feel like your eyes are burning. Your eyes might get red kind of out of the blue, or when you're doing certain activities like reading or even watching TV, if you're watching something that you're staring because you're really interested in it. You might also feel a little bit of like pressure, sometimes patients will say. You might even feel like you're more sensitive to light. Like all lights are super bothersome to you, indoor lights and the sun as well. Your eyes might just feel more irritated overall. And so all of those can be the exact same thing, which when you go to see your eye doctor, they may not give you those 10 or 12 different symptoms. But if you just say, hey, my eyes are just really bothering me, then we'll know that we need to look further into what's going on with you.
And so, Dr. Schneider, what are some of the possible medical causes of dry eye?
The possible medical causes, a lot of them are due to autoimmune diseases. There's an autoimmune disease, and specifically called Sjogren's syndrome, that is like a
Mhm.
co-occurring disorder with lupus or rheumatoid arthritis, which are two other autoimmune diseases that can lead to dry eye. So Sjogren's syndrome is just strictly dry eye, dry mouth, but it also can lead to a higher incidence of blood cancers like non-Hodgkin's lymphoma and multiple myeloma. So it's important that it's diagnosed. Some other causes are, post LASIK, we see a lot of dry eye. So after LASIK, when they make the flap, it's where your cornea is it's cut, and when they make that cut, it transects the corneal nerves, and that can kind of affect the feedback loop that you get from your nerves to your lacrimal gland that tell your body to make tears. So that we see that a lot. Diabetes can lead to dry eye. Thyroid disease can lead to dry eye. Sarcoidosis can lead to dry eye. So just to name a few.
Wow.
Oh, and
Um,
then there's also postmenopausal. Sorry, postmenopausal dry eye is something we see a lot
they have
of.
everything. Menopause, unfortunately, has everything. The list just gets longer and longer by the day,
So
longer
true.
and longer. But one of
Could
the
I answer
Williams
that
sisters,
question, Dr. Renee?
yeah, one side, but one of the Williams sisters has Sjogren's syndrome, I believe.
Oh, she does.
Yeah. Um,
Yeah. It goes with lupus. So I think Venus has lupus and it
Oh,
goes along with lupus. Yes. So
okay.
Sjogren's and lupus often go together.
Okay. Go
Absolutely.
ahead.
I was going to say, in other people that might be affected or medical causes could be are people who are transitioning either from male to female or female to male with those hormonal fluctuations.
Oh,
And
okay.
then also, same with hormonal fluctuations, we talked about um, during pregnancy and post pregnancy as well, because you're having such large fluctuations in the hormones at those times that you might also get dry eye symptoms as well.
Wow. And so what are some non-medical causes of dry eye?
The
Doc-
number one non-medical cause of dry eye is something we started to talk about, our screen use. So back in the day, before the personal computer, it used to be that dry eye was more of a old person's disease. It was postmenopausal for women, things that we worried about if you had autoimmune disease. But since we've all started to have our personal screens that we carry with us all the time, the use of those screens is actually changing the way that our eyes work because we are staring at those screens instead of blinking. And then excuse me, studies have shown that even 30 minutes of using your device straight can actually change how your eye is processing tears and how you're blinking as well. And so just using your screens at all can make actually cause your eyes to become more dry. So things that you can do are to take more eye breaks. We call that the 20-20-20 rule. Every 20 minutes or so, look 20 feet away from your screen for 20 seconds. You're making your eyes relax from looking at that near distance. You're also making yourself go back to blinking at the normal rate. Because when you're concentrating, you tend to stare. Other things, fans, heaters, air conditioners, those things are artificially moving air and kind of artificially causing desiccation on the ocular surface. Even contact lenses for some people. If you're not wearing your contact lenses properly, or if you're over wearing your contact lenses, you might also get symptoms of dry eye as well. Smoking, obviously. The smoke from the wildfires we've had recently in the Midwest is certainly increasing dry eye symptoms just here in the last 6 weeks or so here in Michigan. But also, if you are a regular smoker, hookah, ganja, whatever you like to smoke, may also cause your eyes to be more dry as well. Am I allowed to say that?
You say whatever you like. That's fine.
Also, false lashes. We as women have
Oh
fallen in
God.
love with false lashes. But unfortunately, many women are not cleaning their lashes properly with these false lashes. So your skin is constantly shedding, and that buildup is kind of sitting on the point where your lashes meet your natural lashes or meet your eyelid. And so you're actually causing yourself more dry eye symptoms because of that. So clean your lashes every day. And then the last one is a big one, and that's CPAP machines. We're seeing a rise in obstructive sleep apnea, and CPAP machines are pushing air up your nose and down your throat so that you keep breathing during your sleep. And sometimes that air is escaping, and so it's not necessarily going fully up your nose the way that it should. Sometimes it's going straight up into the eyes and causing overnight dryness as well. So all of those are kind of things to keep in mind.
Wow. So crazy thing. I slept in my contacts one night about a month ago and didn't know it. I never sleep in them because I never wear them. So I never sleep in them. And I woke up the next morning and did my usual routine, and never occurs to me because I'm blind. I have progressive lenses. Never occurs to me that I can see. So when I went and grabbed my glasses and put them on, I almost had a heart attack. Oh my God, I can't see. And that's when it hit me. You still have these contacts in. But amazingly, my eyes were not dry. Because that would have
Thank
clued
God.
me in. Right. That would have clued me in. But I mean, it was the weirdest thing. I was like, I didn't know they were in. I said, oh my God, how did I sleep in these and not realize it? So yeah. But and the other thing you mentioned too, that Dr. Snyder, you said even tearing could be a sign of dry eye. But like I mean, especially once it gets a certain hour, my eyes just water and water and water. And I don't feel like they're dry at all. I just keep wiping. Me and my dad both. We just keep wiping tears. And we're like, I said, oh, it must be time for me to go to bed. That's like my signal.
And sometimes those contact lenses, like that, you should not sleep in contacts. We all
Right.
say that no contact sleeping, but it happens because I wear
Right.
contacts too. It's just the thing. It's a natural thing. You get so tired, you work the whole day, you fall asleep, and you wake up. But so the ocular surface when it's dry, actually has like these little pits in the ocular surface. So sometimes when you put a contact lens on, you actually kind of mask the symptoms of dryness. Sometimes
Hmm.
the contact just dries your eye out and it just feels terrible and feels dry. But sometimes when it's dry, it actually can cover, the contact lens can cover that ocular surface and you actually feel okay with the contact lens on. So, it's good to get it. That's why it's good to get an exam. But essentially, yeah, it could have been that the contact lens masks some of those symptoms of dryness that you probably have. You might have, not probably, you could have.
Yeah, it was just the weirdest thing. I was like, how did I do that? Now, my contacts are they're daily wear. So you're not supposed to sleep in daily wear either. Like I said, I don't wear
No,
them enough.
ma'am.
Okay. I don't
But it happens. It's
I don't
okay.
It
like
does
I
No
said, this
happen.
is
judgment.
something I don't if I wear contacts 5 times in a month, that's a whole lot. So
But I
Yeah.
will say daily wear are so thin that it's less insult to the ocular surface than say if you wear monthly contact lenses. And so that's probably why you didn't have really horrible symptoms. But if
okay.
you wore monthly contact lenses and you slept in them, you'd wake up and feel like you want to tear your eyeballs out because they just completely dry out.
No, when
Completely.
I forgot a long time ago. My contact, we couldn't find it. So I did go to sleep with it because my father had looked. I was looking. No one could find the stupid thing. It was lost somewhere. I knew I didn't take it out, but it was somewhere in there. I went to bed and woke up the next morning and was like, my eye is killing me. I was like, Daddy, it's in here. I know it's in here. We got to find it. Can you see it now? And he got it that time. But it was just the weirdest thing. Hours we tried to get that thing out and couldn't get it.
Pro tip, if you can't get a contact lens out, put some moisturizing eye drops in your eye.
Okay.
Because sometimes the contact lens has suction cup to your eye because you've been messing with
Right.
your eye and trying to get it out. But if you increase the moisture on the surface, you kind of rehydrate the contact lens a little bit as well, and it's much easier to get out.
Okay.
That's for
That,
everybody.
yeah, that was just weird. I was like, get it out.
Absolutely.
So
Dr.
Dr.
Schneider, did
Hugh,
you talk about tearing?
she did. That's why I was saying. She
Okay.
said that, and I was like, oh, because I tear. Um, when should people, Dr. Humes, when should people go to the eye doctor if they have symptoms of dry eye?
Honestly, if your eyes are feeling abnormal, you should go get your eyes checked. It's really just that simple. I think as humans, we are really good at saying, "Oh, it's not that bad. It's not bothering me that much." But in reality, if the condition of your eyes has changed, then that means that something has changed, and we should get that checked out. You should see an eye doctor and tell them that I was fine before, and now I'm having this issue, so that we can get to the bottom of what's going on with your eyes. And honestly, everyone should probably be getting their eyes checked at least every 2 years, just for a health check, as on your list of all the other types of doctors that you see, your dentist, your gynecologist, you see all your other kinds of doctors, get your eyes checked too. Because the interesting thing about eyes is that many of the things that can cause vision loss, you don't know that they're happening at the beginning in the early stages. And so when you come into an eye doctor, we can say, hey, we see something abnormal here that we don't like, and we want to investigate it further. Whereas if you don't come and see us until things have gotten really bad, sometimes we can't fix whatever is wrong. So an ounce of prevention goes a really long way.
And Dr. Schneider, what age would you say people should start getting their eyes checked?
Oh wow. I think I feel like people should start getting their eyes checked maybe as an infant. I mean, usually
Hmm.
the pediatrician will do some preliminary screens, and like in the pediatrician's office, they even actually have like a lot of them have a device like an autorefractor that'll
Mm-hmm.
actually measure an estimated glasses prescription for a child to see if they need anything. But they look for alignment, for all these things that under the age of 12, if you have an eye issue that's not paid attention to, you can actually have a permanent loss of your vision.
Hmm.
So, like as a child, it's called amblyopia. And so
Hmm.
I recommend that people get their eyes checked, even from pediatrician, like baby time, like for an eye check.
Absolutely.
And then once you're like, after you're past the age of, 12, and so you don't need glasses, then you can probably go every 2 years, as Dr. Humes was saying, at least every 2 years.
Okay.
If you've got
I know
anything that's being monitored, I'd say every year.
Okay.
absolutely. In many states, you have
Yeah.
to get to go to kindergarten. So like kindergarten is a good first step so that they can see when they're starting school. And then again, kind of, I would say puberty. So when things are starting to change between 9 and 12. And then again, probably right around 17 or 18 years old, because normally we're going to find your prescription by then if
Okay.
you're going to have one.
Okay. I remember we used to get our eyes checked in school, in elementary school. I'm sure they don't do that anymore. But I remember that we used to, and actually me and my friend, we wanted to wear glasses. And so when we came home and said that my mother, oh, you lied, you faked the test. And because I started wearing glasses in third grade. So no, I did not fake the test. I could not see far. So
But also as parents, Dr. Renee, if you wear glasses, there's a high chance your children are going to need glasses as well.
yeah,
So if you're nearsighted and you knew that you needed glasses at 6 or 7 years old, you probably should get your child checked around that same age because genetics are strong.
right. Yeah, my dad is farsighted and the rest of us are nearsighted. Me, my sister, my mom. Yeah. But there was somebody I knew, she's a doctor too, and um, she noticed her daughter squinting and everything. And she had a bad experience in childhood with glasses. And so she just didn't want her daughter to go through that. And
Oh
so
no.
she shared the story with us, and we were like, if you don't go get that child glasses, there are very cute glasses now. And
Mhm.
she doesn't have to be bullied and, all this stuff. And of course, they ended up finding her some cute, colorful glasses, and, and now she can see in class and everything. But she noticed that her daughter was struggling. And so she's like, I'm going to have to, we're like, yes, please do something. The poor
You
child.
bring up a good point, though. What are the symptoms of your child needing glasses? Squinting is a big one. If they avoid reading, if they're having trouble seeing things up close, your child will avoid reading. If you know your child is smart, but they are super disruptive in class, they may not be able to see well enough to either, see the board,
Right.
whatever kind of whiteboards they use these days,
Right.
or I don't know the names,
Yeah, it's not a
or if
chalkboard
they're
anymore. Mhm.
correct. Or if they're using devices at school and they're struggling to see those devices, they may be disruptive in classes as well. So those are definitely things to kind of pay attention to your for your children.
Definitely. Dr. Schneider, which tests are performed in the eye doctor's office to assess the dry eye?
Okay, so yeah, for when you go to get your dry eye assessed, I think the first test I would recommend to be done is actually just a questionnaire. So there's like several questionnaires. There's one called the OSDI, Ocular Surface Disease Index questionnaire. Then it kind of gets an idea of where the dry is coming from. Is it more of a lack of a tear production, or is it more of a deficiency in the oil layer, an evaporative dry eye is what we call it.
Mhm.
And so that's kind of the first step. The second really would be I often will do, like in the dry eye center, we do a test called a tear osmolarity, which measures the salt concentration of your tears. And that'll kind of tell us if if your tears are concentrated, it means there's not enough water.
Mm,
Then there's another test called Inflammadry. Inflammadry measures inflammatory markers in your tear film. To it kind of will give us an idea if it's an inflammatory dry eye, like the Sjogren syndrome or rheumatoid that we were talking about. Then we do another test where we image your meibomian glands, those with oil glands in the eyelid, that if they get blocked or clogged, it'll cause a sty.
right.
So we can see if those are blockages or anything like
Mhm.
that. So that kind of lets us see how those are functioning to assess if it's an evaporative dry eye. And then finally, just looking under the slit lamp is a major thing. You look and you put a stain on the cornea. There's several different stains, but one stain that's most commonly used is called fluorescein. It's like a yellow dye that's put into the eye, and you look at the surface under the microscope. If the eyes are very dry, you'll see tiny little pits like sandpaper under the microscope, and that's an
Mhm.
indicator that the eyes are like above threshold dry.
I remember that test.
Oh, yeah, it's the yellow
Yeah,
dye. It's
exactly.
you come out and your eyes are
It's
like
like, here's a tissue. And I'm like,
exactly. It's all yellow
out
or
of my
orange.
clothes.
It's all
Right.
yellow and
And don't
orange.
wear white. Don't wear white.
Exactly.
And don't put your contacts back in right after that.
Right.
Yeah,
No.
exactly.
Yeah, I remember that test. Yeah, definitely. And if I'm going to the eye doctor for a dry eye exam, will I get a full comprehensive eye exam as well as, or just the dry eye?
So I think it kind of depends. I feel like for me, if someone's main symptom is blurred vision, now dry eye does cause blurred vision, but the blurred vision with dry eye usually clears when you blink. It's usually kind of worse at screens. Some people come in with blurred vision and they'll really have something else like cataracts or macular degeneration or something like that. So if that's the case, you should have a true comprehensive dilated exam. So first you want to rule out any causes of blurred vision like glaucoma, macular degeneration, cataracts, like those causes that can be damaging. And dry can be damaging, but in a different way. And so with there are some preventions we can do, some treatments that we can do, as Dr. Humes had mentioned. So those are the kind of things that I would do, like a comprehensive exam if someone's chief complaint is blurred vision. If you've already had a comprehensive exam and you were just dilated recently, and your chief complaint is something burning, then maybe not. I usually leave it that to the patient's discretion if they've just had a dilated exam. But you should have a dilated exam at least once a year, or once every 2 years if you're very healthy.
Right. Dr. Humes, what are the best first-line treatment options for dry eye?
It's a good question. So there has been a explosion in treatments for dry eye, and each of them is kind of geared towards the different types that Dr. Schneider talked about before. So artificial tears are the one that everyone can get on the market, are also called rewetting drops, also called moisturizing eye drops. There are a bunch of different kinds. As eye doctors, we tell patients stay away from the ones that say get the red out. So no Visine, no Clear Eyes. They're not really fixing the underlying problem. They're just making your eye look aesthetically better. So we're not really fixing the dry eye. So the artificial tears, there are a bunch of different brands on the market. And if you use them, you can't use them just once a day. One of anything is really not helpful. We found with research that 4 times a day is a good start. Breakfast, lunch, dinner, bedtime, every 4-ish hours. If you're having any of those symptoms we talked about, you should probably be using your drops 4 times a day. If you do use your drops 4 times a day regularly and you're like, I still don't feel great, that's when you need to come in and see us. Because now it's time to move on to the next steps in therapies. And there are a number of different therapies on the market because the pharmaceutical industry has realized that there are 16 million Americans with dry eye. And so they are constantly coming up with new treatments for the different types of dry eye. And so we have, I won't mention like the medical names, but you might go initially if you have inflammatory type of dry eye from some of the diseases Dr. Schneider talked about, lupus or Sjogren's or sarcoidosis. You might start with a short course of topical steroid eye drops to kind of bring down the inflammation. And then we can see if that's why you're not making enough tears. But long term, you may also end up, so it's something called a punctal plug, which is essentially a small piece of plastic that we put in the puncta, which is the little drainage holes in your eyelids there. And those can be permanent, but they may also be short term. So your doctor might have you use them for 3 to 6 months to see if putting them in relieves your symptoms. Other things that we could do, there are nutritional supplements on the market now that are still being studied, but we probably all are not eating the right balance of vitamins and nutrition that we need for our eyes in general. So most of the time, in my opinion, vitamins are usually a good idea. And one of the major ones that you can try is actually omega-3. And so fish oil or krill oil is very helpful for your joints and your heart and circulation in other parts of your body, but it's also helpful for your eyes as well. Now, when you see Dr. Schneider, she might do more advanced treatments like LipiFlow, which is to help open up those meibomian glands that she talked about. And there's also actually laser treatments called IPL, which can also help the eye make more tears naturally. And those are something that you would have done at a dry eye center, which is what Dr. Schneider does.
Okay.
Dr.
And
Schneider,
then,
do you have any other new ones out there that people might
I
get
think you
while they're in
covered most of
office?
them. I think you covered them all. Um, did you mention serum tears? No, Dr. Humes?
Oh, I didn't actually.
Yeah. So essentially, there's the only thing I can think that was pretty comprehensive about everything that I normally would recommend beyond over-the-counter drops. The only thing, there's another newer thing out called serum tears or plasma tears, where they a compounding pharmacy. It's not covered by insurance. Compounding pharmacy comes out, they draw your blood, they kind of spin it down, they take the plasma and they dilute that and make it into a drop that you can administer to your eye. So it's been found to be helpful. I get a lot of good reports back on how well it works. Clinically, it's not as, with the drops that are prescription. Sometimes those can cause stinging and burning. Usually, it doesn't sting or burn. It's your own blood plasma. People don't really have reactions to it. It's not like an allergic reaction. We don't have to worry about that aspect of it.
Absolutely. Oh, I forgot amniotic membranes. Do you
Oh,
use
that's
those, Dr.
true. That's
Schneider?
true. Yeah, I did just recently. They're comfortable, but amniotic membrane grafts also will treat an ocular surface. It's where a piece of cryopreserved amniotic membrane tissue is a disc, and you just administer it to the patient's cornea, and you leave it there. It stays there, kind of the patient's system over like a 3 to 5 day period. They come back, and that is good. It's very helpful, but it can be uncomfortable. So it feels irritated for like 3 to 5 days while you wait for the amniotic membrane to kind of take hold. And it's supposed to really help with ocular surface disease where the whole surface from dryness, from severe dryness.
So Dr. Humes, tell us about eye drops and what tips you have for viewers about using eye drops.
Some of them I already said.
Yeah.
Patients often complain to me about getting the eye drops in their eye. Like that's the hardest part. I think many of us are possibly making it more difficult than it needs to be. So what I have my patients do is I actually have them put their eye drops in with their eyes closed. And so I tell them I know, follow me here for a second. So pretend that my pen is the tip of your eye drop. You're going to take the pen, you're going to close your eyes, and you're going to touch it to this little spot right here.
Okay.
With your head back, of course. You're going to squeeze your eye, you're going to squeeze the bottle, and then you're going to blink. The eye drop is going to go in all by itself without you having to pull your eyelid down and aim and do all of these things that people do in the mirror. We don't have to do that. Now, if you are, I don't recommend you share your eye drop bottle with other people.
Right.
But if you are, make sure you clean the top with an alcohol swab, of course, so you're not sharing each other's normal flora. Because we don't need to do that.
Right.
And possibly causing infections. But other than that, I think using artificial tears is an okay thing. But if you're finding that you're using them regularly and you haven't seen your eye doctor, you should definitely go in and get checked.
Okay, that's very interesting about how to put them in, though. I've never thought of that. I never.
Pro tip.
Yeah, that's very different. And you know what? I always tell people, this is why I can't get LASIK, because I can't see you doing things like to my eye. And with that, with the drops, I can always see it coming and you're anticipating it. It's like, oh God, here it comes, So that's a good idea.
And then you miss because you're like, oh God, here it comes. And now you're wasting the bottle down your cheek.
Right.
And these things cost money. They're not free.
Yeah.
And the bottles are quite expensive these days. An artificial tear bottle might cost you $20. So you don't want to waste the drops.
Yeah. I'm definitely going to remember that tip. And
very good for kids too.
Yeah, and I was going to say, especially for the children. They'll start to be able to do them themselves. So, Dr. Schneider, how can inflammatory conditions that contribute to dry eye be diagnosed?
That's a good question. So, inflammatory conditions like Sjogren's syndrome are usually diagnosed. I usually send people on to their primary care for that. And I order blood work. So the blood work would be like an ANA, a rheumatoid factor, a test called anti-SSA, anti-SSB. I usually order a SED rate and a C-reactive protein, inflammatory markers. And that's usually my whole dry eye panel. And I usually have the primary care do it. Occasionally I'll do it myself if someone like doesn't have a primary care, or the primary care is not interested in doing it. They didn't hear the same history that I heard. But I like the primary care to do it because I feel like care needs to be coordinated. If you have Sjogren's syndrome, dry eye, dry mouth, aches and pains, things like that, you probably need a rheumatologist to get involved at some point. Sometimes systemic treatment can be helpful, like Plaquenil, or steroids. And so if you need those things, typically it's not going to be the eye doctor doing it. It's going to be really a whole team of people that's going to be treating you for a rheumatologic condition. So I tend to send out those labs, and occasionally I'll do them on my own. And it comes back positive a handful of times. Usually it's when people are complaining of really severe dry mouth, and sometimes they don't even know they have a dry mouth, but they'll find that they have a lot of dental issues, a lot of cavity, a lot of tooth and dental implants done, root canals recently. And then a lot of times, some of the dentists will say, or a hygienist will say, your mouth is dry. So that's when I usually order that. And then that plus people come with a constellation of joint ache, joint pain, things like that. Rashes. Sometimes with lupus, you can get a rash on your face. Right. It's like a butterfly rash, as you know, Dr. Renee and Dr. Hume. It's like a butterfly rash that you can get on your face. That can be an indicator that you have an underlying inflammatory rheumatologic condition.
And Dr. Humes, what lifestyle or environmental changes can help improve dry eye symptoms?
Number one, again, take your eye breaks. 20-20-20 rule. 20 feet away, out the window. There's one right there behind me for 20 seconds every 20 minutes. If you can shoot for twice an hour, something is better than nothing. Other things, turn fans down or away from the face. I know us women of a certain age, we need our nighttime fan, and that is okay. But that nighttime fan could be one of the additional factors that is causing your dry eye symptoms. So turning that fan down or wearing a sleep mask, if you can stand wearing a sleep mask, will also help to kind of shield the eyes while you're sleeping. I'm not one of those people who can wear a sleep mask. I'm not either. But other people can.
My sister
It's a good thing to try. Eating your green leafy vegetables. That sounds like a simple thing. But the beta carotene in collard greens and kale and spinach and broccoli are all very good. They have antioxidants that are also good for the eyes as well. And hydrate. Drink your water. I know that we say this all the time, but that 8 glasses of water that you drink every day, it helps your body in so many ways, including with your eyes. And then the last one, and this is a big one that people forget, is protect your eyes from UV light. Our eyes need to be protected from the sun. Just like we're all supposed to wear sunglasses, we're all supposed to use sunscreen, Black people. Sunscreen. We all need to wear sunglasses as well that are UVA and B blocking, because unfortunately, UV damage is something that accumulates over the course of our lifetimes. And that is something that we have to deal with sometimes when we get into our elder age with our eyes. And so it increases our risk for cataracts as well as macular degeneration, which Black people can get that too.
Do the blue blockers, does that really work?
See, that's the question. This is the thing. Every digital device has night mode. Night mode means that they have turned off the blue blocker within the device itself. So, but some patients will tell me anecdotally that blue blocking glasses make them feel so much better when they work on computer for long periods of time. If you like it, I love it.
I will say the difference between, because I have 2 pair non-blue blocking and 3 pair with it. So I usually try to switch because I noticed that because I trade and I'm looking at the charts and the candles, and honestly, it's actually clearer with the blue blocking ones than the other ones. So I was like, so now that's when I said, keep some
now, whether or not that's helping with, circadian rhythms and things like that, that's still up for debate. The majority of the blue light that we're getting in our world is actually from the sun itself. It's not from our devices. But if the blue blocking makes you feel more comfortable on screens, use it. Yeah. I have a few pairs.
Yeah. So my main glasses, I didn't get that, but then when I bought some cheapies, I was like, oh, well, just throw it on there. And like I said, I do notice the difference when I'm, sitting at the computer all day, especially if I'm looking at the charts and trying to read numbers that are small. And so I was like, oh, I can see better with these.
But it probably increases the contrast as well.
That may
which
be
makes
what it
things
is.
feel more crisp.
Yeah.
Because it has that tint to it.
Yeah. So I think, and I mean, all of my glasses are progressive lenses, so it's not that. It must be, yeah. Okay.
Yeah.
Very interesting. So Dr. Schneider, which oral medications worsen dry eyes?
So there's a ton of oral medications that make dry eye worse. Kind of the biggest offenders I see are antihistamines, antihypertensives, antidepressants, decongestants, chemotherapy drugs. And surprisingly, even though menopause is a cause of dry eye, actually kind of hormone replacement therapy can sometimes cause dry eye as well. And I think it's the progesterone in it. So it's kind of a thing where Menopause does it, then hormone replacement will do it too. So it's like a balance there. But those are the main ones I see on a regular basis.
The
I
antihistamine
see a
makes
lot of
perfect sense.
kids.
You're
I'm
trying
sorry,
to
I want
dry
to
everything out.
add. I
Yeah.
see a lot of kids. Other ones are Accutane.
Oh yes, Accutane.
Lots of kids are on Accutane these
So
days.
true.
And then your focusing meds, Strattera, and these other types of ADHD meds will also kind of do the same thing,
Oh,
which I see a
And
lot in kids.
anxiety,
Oh yeah,
anxiety and sleep medications.
wow.
a
Goodness
long
gracious.
list.
Yeah, a long list is right. So Dr.
And
Humes,
Accutane actually affects. I'm so sorry to
no,
interrupt,
you're
Dr.
fine.
Renee. I'm sorry about that.
No, you're
I
fine.
just Dr. Humes reminded me that Accutane does the meibomian glands,
Hmm.
and so that's where it targets. So it's more the oil. Another one now I'm seeing a lot is Dupixent, which is
Yes.
given for atopic
Eczema and stuff.
dermatitis,
Yeah,
but it
yeah.
also causes dry
Eczema.
eyes.
Hmm. So if your doctor isn't asking you to go get a baseline testing or a baseline eye exam before you take these meds, that is something that we should all keep in mind.
Oh yeah,
Mhm.
definitely. Dr. Humes, since we were talking about children, can children actually get dry eye? And if so, would the treatments be the same or different?
The children don't get the same type of dry eye that older people get.
Okay.
Children get primarily meibomian gland dropout, like Dr. Schneider was talking about before. And that is primarily due to screen use. So that continuous screen use actually changes the anatomy of the eye, which is kind of terrifying if you think about it.
It is.
And those meibomian glands, once you lose them, we can't get them back. They're
Now, where
gone.
are they again? Explain to that us again.
They
Where?
are kind of in the upper and lower eyelid. You can, if you pull down your eyelid, you can kind of see little holes in your eyelid if you look really closely.
Okay.
And so they are spread kind of across the lids. And once you lose them, they're very difficult to either open up or get back if they atrophy and have gone away. And so we're finding this in more recent studies of gamers. So students who have started gaming at like professional gamers, excuse
Right.
me. So people who are professionally gaming in college and things like that, we're finding that these students have like 60% less meibomian glands than other students because of the gaming and the staring at the screens. It's literally changed the anatomy of their eyes.
Okay.
Mhm.
Wow.
So get your kids about all those games, get them outside.
Yeah. Yeah.
That's how we decrease myopia. We need to get outside and get our natural vitamin D. So kids should be playing outside for at least an hour every day, no matter what the weather is, for their eyes and for their body as well.
Right. Exactly.
Mhm.
Physical health as well.
Yeah.
Dr. Schneider, is there a risk dry eye could cause damage if untreated? And what would that damage be?
Yes. So most to reassure people, most dry eye is not going to cause severe damage. Thank goodness. So it's like most people are going to be okay. Rarely, when it's very severe, it can cause such damage to the ocular surface that it predisposes you to infections, like something called a keratitis, which is a bacterial infection of the cornea. And so that can become damaging to the ocular surface, of course. And then you can also get corneal ulcers. So that's like an ulceration of the cornea, pit area forms in that pit. Now, contact lens wearers are also kind of increased risk for both of those things, keratitis and corneal ulcers. But yes, dry eye can lead to that. Really severe dry eye, sometimes you can get something called corneal neovascularization, where blood vessels grow from the white of the eye, they call the conjunctiva. It grows onto the surface of the cornea. And so those are some of the risks. But by and large, most people with dry eye, it'll just be something where their eyes are very irritated. But if you kind of let that go, kind of like most things, if you let it go unchecked, it can cause problems for you.
Gotcha. And Dr. Humes, what are the long-term risks of ocular steroid use?
I actually wanted to ask Dr. Schneider
Go
a
ahead.
question since we're here together. And we were talking about contact lenses and contact lens overuse. You did talk about corneal neovascularization, which can happen when you wear your contact lenses too much. Would you also talk a little bit about like the final consequences of stem cell degeneration?
Yeah, so that's the thing. I was going to say that, but I know we talked about this.
I
You
think
and
we
I talked about this
should, because
before.
these are
We
risks that
have,
people should
because you're like,
know.
because limbal stem cell deficiency can be a cause of dry eye as well. And so it's where The limbus is like the part of the eye, the cornea, kind of right where the margin between the cornea and the conjunctiva. So it's hard to describe it. It's like where if you're looking in the mirror, it's where your colored part kind of disappears into the white of your eye. It's that border where your colored part goes to the white of your eye. And so if the cells there begin to underproduce, then your surface becomes very dry, and sometimes the conjunctiva will actually grow on top of the cornea. So limbal stem cell deficiency is like one of the cases where I will put a amniotic membrane graft on, because it's supposed to help with that particular condition. But it's something that we see. I see it probably more just because it's a dry eye center. So I'm only seeing like the most severe cases of dry eye. But by and large, probably the people that we see most of the time are not that severe. Thank goodness.
Absolutely.
Now,
but you can cause this to happen to yourself if you constantly sleep in your contact lenses when you're not supposed to. You can actually cause yourself to eventually have that issue.
And the conjunctiva.
And I usually tell people to wear their contacts. Oh, sorry.
Go ahead.
Oh, sorry, Dr. Renee.
Am I breaking up again, Dr. Renee? Am I breaking up, Dr. Renee? I know my reception is a little spotty.
Yeah, you're
I
fine.
usually tell people to wear their contacts, and I don't know what you say, Dr. Cubes, but I usually say more than 8 to 10 hours a day and no more than 6 days a week. I usually recommend people take a break for no contact lenses.
That's a great idea.
Altogether. So, and I wear dailies myself. I'm wearing them right now, and Dr. Renee, like you do. And so I usually say, like, right when you get home, just take them right out.
Mm-hmm.
You know?
Absolutely.
I was going to say the conjunctiva, you said it grows over it. Does it have a different color when it does that?
I think it does under the microscope that we can see, but I don't, when you're looking in the mirror, you may not be able to see it yourself. So we can see it under the microscope when we're looking at you under this lamp, but in the mirror, some people can see things in the mirror. Some people come and say, I think I have an infection, and you look and they do have like an ulcer on their cornea, like it looks like a white spot, but most people don't see it. This neovascularization, because a lot of people go for LASIK and then they find they can't do LASIK because the conjunctiva has grown onto the cornea, and the LASIK surgeon doesn't want to cut the flap because it can cause bleeding underneath the LASIK flap if you cut one of those blood vessels.
Oh, okay.
Or more than
I had a
one.
relative that, because of diabetes, was losing their eyesight, and her eyes changed color. And I forgot what drop. She had to put in drops all the time too. But it was like they went to like a bluish color, and I was like, and it was funny. She would say she could see better when it was dark. I was like, this lady is telling us all sorts of stories.
Like, some of the glaucoma drops can change the color of your eye. Like latanoprost can change the color of your eye. But when people see the bluish color, usually they're referring to something called an iris senilis, which is basically a sign. If we see it in people who are younger, it's a sign of high cholesterol. When we see it in older people, we kind of don't make much of it because at some age, kind of after age 40, 50, we all kind of might start to develop that slight arcus. So kind of it looks like your eyes have turned blue, but it's white combined with the color of your actual iris, can have a bluish tint or bluish hue to it. So if you see that in your 40s or 50s, then you need to go to primary care and get your cholesterol checked.
Boom.
Got it. So for both of you, and I think we kind of covered this, is dry eye chronic or can it be successfully cured?
That's a good question. I think that dry eye is often chronic, depending on the root cause of your dry eye. If your root cause of your dry eye is an autoinflammatory disease and your rheumatologist is able to get you on a combination of meds that get it under control, your dry eye may completely disappear. If your dry eye is due to menopause, sometimes once you get through menopause, your dry eye symptoms may get better. But for many people, dry eye is chronic. It might even be episodic. You might even only have dry eye at certain times of the year. In Michigan, a lot of people only have dry eye in the wintertime when the kind of natural humidity outside has gone down and we're running the heat inside our homes. And so it gets super dry. And so I'll have patients who have much more dry eye symptoms only in the wintertime. So it depends on what really is the root cause of your dry
eye. And do you guys, can you both give final advice for patients about managing the care for their dry eye? I don't care who goes first.
No, I think I first I think that I definitely agree with everything Dr. Hume just said about the chronicity of dry eye. I think that sometimes if you're on a drop like an anti-inflammatory drop, like a topical cyclosporin, like Restasis is a common name for it, or another one's Xiidra, Cequa, another one's Vebi. Those drops, sometimes if you're on them for like a year or so, things people say they feel better, and I'll let people like stop it and see how they do. And sometimes it'll kind of right itself, like she was saying. Dr. Humes was saying it. Sometimes it'll kind of get better on its own. I think my final advice would just be to, I think we talked about, just make sure if you have something that you're worried about, get evaluated, um, and work with your physician to determine, what would be the best course of treatment. And I think that, just don't be too, what I worry is when people are too worried that it's going to cause like dry eye will cause like permanent damage. People will come crying and they're like, oh no, I think I'm going to go blind from this. So that's rare. And so you shouldn't ignore it, but don't worry too much about it, because usually it can be treated. So it's a chronic condition, but there are wonderful treatments. So there's hope there.
I agree with everything Dr. Schneider said, but I would add just some things about general eye health. Nobody wants to go blind. Everyone is
Man.
terrified of going blind. But yet, we as Americans are very bad about our ocular health. We don't get in to get our eyes checked on a regular basis. We ignore red flags, changes in vision, sudden changes in vision, or even slow changes in vision. We just, oh, maybe it'll get better all on its own. We start to lean on over the counter readers when we know we can't see. So we really should go and get our eyes checked. I know there's somebody out there who hears me. You're 55 years old and you got two pairs of readers on. It's time to get your eyes checked. um, let's wear our contact lenses properly. They're little pieces
Right.
of plastic that go in your eyeballs and they can harm you. And
Yeah.
we don't want to have to send you to see Dr. Schneider because you have developed limbal stem cell degeneration from contact lens overwear. So I'm encouraging everyone to consider your eyes as an important part of your body as well. So go and get your eyes checked, please.
Definitely. And I mean, look, in 2025, it's the wrong thing to say, but hopefully your employer has vision insurance, because I know that the first job I got out of med school did not have vision coverage.
Mhm.
And so
And if you have a medical issue, your medical insurance will cover your eye exam as well.
yeah, but the medical we had, so, so I was like, this is crazy. I know that my eyes need to be checked. And so I eventually, got something else. But I was like, this is crazy. But yeah, it's very important. And especially now with all the eyelashes. Oh my God.
And y'all, eyelashes do not need to touch the back of your glasses.
I have always thought this myself.
That's all I have to say about that.
I wore extensions myself, and mine did not do that.
They actually can impede my ability to check your eyes.
I cannot imagine somebody.
They are getting that long that the lashes are hanging down into your vision so much that we actually can't use our pre-testing equipment. Your lashes are down into the phoropter, the machine that we go, which is better, 1 and 2.
Right.
Your lashes are sticking in the little hole. And so, because they're so long from your eye, that we are unable to refract.
I'm embarrassed for the person.
It happens a couple of times a month that I'll have to ask someone to reschedule. It does happen.
That's awful.
It is awful.
I call them blinds and shutters.
I call them butterfly wings.
Yeah. I like I said, I wore extensions myself, but my mother said, I thought you got your eyelashes done. I was like, see, that's why they're good. You can barely tell I got them. And so she was like, oh, she did a great job. I said, see, worked out. But yeah,
please clean those lashes if you're going to get them.
Yeah.
They sell lash cleaner. Get the little scrubby
the
brush.
Little scrubbing brush. Yeah.
Yes. Please clean your lashes every single day when you wash your face.
Yeah. That's why my lady left, and I don't trust anyone else, because I've seen way too many TikToks and Instagram reels with eye infections. I was like, nope, can't have anybody else put them on. I'm terrified.
But that's valid. The number of corneal abrasions and eye infections I have seen just post lash application, it's real and it happens every day.
Tamar Braxton posted. She posted a video and said that's what happened to her. I was like, nope, see? Mm-mm.
She's famous.
Exactly.
She can make a lot of
She
money.
could pay a lot of money. That's what I was like. If it can happen to her, it can happen to me. I know the person I went to. We were together a long time, and I trust her. And I said, I can't trust anybody else. I just makes me nervous.
I get it.
Well, thank you so much. I did not know dry eye was so interesting because I just had no idea. That's a lot of stuff. And a whole dry eye center, that is really phenomenal. But
And if you want to find a dry eye center, how do you find a dry eye center,
yeah.
Dr. Schneider?
Oh, that's a great question. I think they're popping up more. Dr. Coombs, do you have a dry eye center too, or you just
So
comprehensive?
the group that I
General,
work with in Michigan does have a dry eye center. I work for Henry Ford Health, and so we do have a dry eye center. But as we were talking about, dry eye is so ubiquitous, it's booked out months because there's so many people who need kind of advanced procedures for dry eye. And so you can Google Dry Eye Center of Excellence near me or Dry Eye Doctor near me, and you if there are any doctors in the area who specifically are treating dry eye, that will pop up for you.
Wow. Well, I hope everyone that needs to do that does that. And actually, probably everyone should just keep it in their back pockets because you just never know. And like you said, we are religious on, oh, it'll just go away. It'll just go away. Oh, it may not go away. And you need to take care of it. And
denial does not do anything. It gets you further up the river.
Exactly. So you don't want to get it so bad that you need some very, very serious intervention. Some drops is simple little thing. But thank you so much for your time this evening, and everyone. We'll see you next time, Black Doctor.
Thank you so much.